Good morning and welcome to my channel. Today you will learn how to effectively present a topic on understanding diabetes mellitus, implications for eye health. In this video, I'll share a model presentation to guide you in discussing this important subject. Remember, diabetes is not just a condition that affects blood sugar levels. It can have serious consequences for eye health, including complications like diabetic retinopathy. The goal is to provide a clear and informative presentation that raises awareness and helps others understand these connections. Let's get started.
Good morning, everyone. Before we begin our presentation, allow us to introduce ourselves. My name is Hugo and my friend is Ida. We are first semester students of Diploma 3 Optometry Study Program. We are going to talk about understanding diabetes mellitus, implications for eye health. There are 11 points we are going to discuss. 1. Definition of diabetes mellitus. 2. Types of diabetes mellitus. 3. The signs and symptoms of type 2 diabetes. 4. The risk factors of diabetes mellitus. 5. The treatment of diabetes mellitus. 6. The diagnosis of diabetes mellitus. 7. The complication of diabetes mellitus. 8. Diabetic retinopathy. 9. The common symptoms of diabetic retinopathy. 10. The causes of diabetic retinopathy. 11. How to prevent diabetic retinopathy. I am going to talk about point 1 until 5, and my friend, Ida, is going to talk about point 6 until 11. Diabetes mellitus is defined as a metabolic disorder in which the body's ability to produce or respond to insulin is impaired, resulting in elevated blood glucose levels. Point 2 is the types of diabetes mellitus. There are 3 types of diabetes mellitus. Type 1 diabetes is an autoimmune condition where the pancreas can't produce insulin and requires lifelong insulin therapy. Type 2 diabetes is a metabolic disorder due to insulin resistance and insufficient insulin production. Gestational diabetes occurs in pregnant women due to hormonal changes affecting insulin production. Resolves after birth, but increases the risk of type 2 diabetes later. Point 3 is the signs and symptoms of type 2 diabetes. There are several signs and symptoms of diabetes mellitus such as increased thirst, increased hunger, unexplained weight loss, fatigue, increased urine output, blurred vision, slow healing, and numbness. Point 4 is the risk factors of diabetes mellitus. There are 2 risk factors of diabetes mellitus. The first is modifiable risk factors that we can change like weight, physical activity, and healthy lifestyle choices. The second is non-modifiable risk factors that we cannot change like family history, age, ethnicity, and gestational diabetes. Point 5 is the treatment of diabetes mellitus. Type 1 diabetes mellitus can be treated by insulin injection. Oral medications can treat type 2 diabetes mellitus. Lifestyle modifications can also treat diabetes like a balanced diet with controlled carbohydrate intake, physical activity like regular exercise to help lower blood sugar levels and improve insulin sensitivity, and weight management to achieve a healthy weight. Now, my friend, Ida will continue the presentation.
Thank you, Hugo. Point 6 is the diagnosis of diabetes mellitus. Type 2 diabetes can be diagnosed by hemoglobin A1C, HbA1c, test, fasting blood sugar test, oral glucose tolerance test, and random blood sugar test. Point 7 is complication of diabetes mellitus. Complications of type 2 diabetes occur when blood glucose levels are not managed correctly. Diabetic retinopathy is a complication of diabetes that affects the eyes. Diabetic nephropathy is a complication of diabetes that affects the kidneys. Diabetic neuropathy is a complication of diabetes that affects the nerves. Peripheral vascular disease, PVD, is a condition that affects the blood vessels outside the heart and brain, particularly in the legs and arms. Point 8. Diabetic retinopathy is a complication of diabetes that affects the eyes and can lead to vision loss. It happens when high blood sugar levels damage the blood vessels in the retina, which is the light-sensitive layer at the back of the eye. Point 9. The common symptoms of diabetic retinopathy. There are 6 common symptoms of diabetic retinopathy. 1. Blurred vision, difficulty focusing or seeing clearly. 2. Dark spots or floaters, seeing spots, lines, or shadows that float across your field of vision. 3. Vision loss, reduced central vision or the inability to see well in low light. 4. Distorted vision. Straight lines may appear wavy or distorted. 5. Difficulty seeing at night. Increased difficulty with night vision. 6. Color changes. Changes in the perception of colors. Point 10. Causes of diabetic retinopathy. There are 8 causes of diabetic retinopathy. 1. Chronic high blood sugar levels. 2. Hypertension, high blood pressure. 3. High cholesterol levels. 4. Tobacco use. 5. Duration of diabetes. 6. Obesity. 7. Genetic factors. 8. Pregnancy. Point 11. How to prevent diabetic retinopathy. To prevent diabetic retinopathy, we must 1. Manage blood sugar levels. 2. Control blood pressure. 3. Maintain healthy cholesterol levels. 4. Regular eye exams. 5. Avoid tobacco use. 6. Eat healthy diet. 7. Exercise regularly. That's all about my presentation, and thank you for listening.
Practice is the key to mastery. Every effort, no matter how small, gets you closer to perfection. Keep going. Your dedication will pay off. Latihan adalah kunci menuju penguasaan keterampilan berbahasa. Setiap usaha, sekecil apapun, membawa Anda lebih dekat ke kesempurnaan. Teruslah maju, dedikasi Anda akan membuahkan hasil. Salam dari Pak Budi.